Before I start this video, I want to point out that I'm not a doctor, I'm not a dietitian, I'm not a nutritionist, I'm not a chemist, I'm not a scientist, I'm none of that stuff, not an RN, not an LPN, not a nurse practitioner, not a chiropractor, nothing like that. So this is not medical advice. This video does not constitute medical advice. What I was saying at the end of my last video, or the first video in this series, before I was cut off, was the, essentially, taking metformin can cause interactions with other medicines like diuretics, thyroid medication, etc. Other medications that you may need. And type 2 diabetes, generally speaking, is manageable without the use of what? Without the use of medication a lot of times. Okay? So a plant-based diet for the prevention of type 2 diabetes. Okay? So the cohort studies strongly support the role of plant-based diets and food and nutrient components of plant-based diets in reducing the risk of type 2 diabetes. Evidence from observational and interventional studies demonstrates that benefits of plant-based diets in treating type 2 diabetes and reducing key diabetes-related macrovascular and microvascular complications, meaning your big blood vessels and your little blood vessels don't have the same complications if you're following a whole food plant-based diet. Optimal macronutrient ratios for preventing and treating type 2 diabetes are controversial. The focus should instead be on eating patterns and actual foods. However, the evidence does suggest that the type and source of carbohydrate, unrefined versus refined, fats, monounsaturated and polyunsaturated versus saturated and trans. So let's take note of that. So with the carbohydrates, you want whole foods. With the fats, you want monounsaturated and polyunsaturated, not saturated and not trans fats. And with protein, you want plant proteins, not animal proteins, to prevent type 2 diabetes. These play a major role in the prevention and management of type 2 diabetes. Multiple potential mechanisms underlie the benefits of a plant-based diet. Okay, this is the introduction, blah, blah, blah. Okay, plant-based diets for the prevention of type 2 diabetes. Okay, observational studies strongly support the role of plant-based diets and components of plant-based diets in reducing the risk of type 2 diabetes. Large cohort studies demonstrate that the prevalence and incidence of type 2 diabetes are significantly lower among those following plant-based eating patterns compared with omnivores and semi-vegetarians. Those following plant-based diets tend to have lower body mass indexes, which protects against type 2 diabetes. Nevertheless, differences in diabetes risk persist despite adjustments for body fat percentage. The Adventist Health Study 2 examined the disease prevalence by different eating patterns in an overall health-conscious cohort, meaning most, well, if not all Adventists are severely health-conscious. Among nearly 61,000 individuals, the prevalence of type 2 diabetes decreased in a stepwise fashion with each reduction in animal products. So the more animal products you reduce, the lower your risk of type 2 diabetes was. From 7.6% in non-vegetarians, 6.1% in semi-vegetarians, 4.8% in pesco-vegetarians, 3.2% in lacto-ovo-vegetarians to 2.9% in vegans. The apparent protection of the vegan dietary pattern remained after adjustment for body mass index and other variables, with vegans having half the rate of diabetes, type 2 diabetes, compared with non-vegans. Vegetarians experience, okay, we know about all that because I just read it. Prospective studies of the same Adventist cohort demonstrate similar findings. Individuals followed for 2 years, multiple logistic regression analysis controlling for body mass index and other variables demonstrated that vegans had a dramatically lower risk of developing type 2 diabetes compared with non-vegetarians. In another study, 8,401 members of the Adventist Mortality Study and Adventist Health Study long-term 17 years, adherence to a diet that included at least weekly meat intake was associated with a 74% increase in the odds of developing diabetes compared with long-term adherence to a vegetarian diet, zero meat intake. This association was attenuated but persisted after statistical adjustment for weight and weight change. So even if you're of a healthy body mass index, your risk of developing diabetes is higher if you're consuming meat even once a week. In a cohort of 4,384 Taiwanese Buddhists, vegetarian men had approximately half the rate of diabetes, and vegetarian postmenopausal women had a quarter of the rate of diabetes compared with their omnivorous counterparts, despite statistical adjustment for body mass index. So you're seeing the size of the body doesn't matter, nor does the ethnicity, because the Adventists were most likely Caucasian or black. Interestingly, the omnivores in this study consumed a predominantly plant-based diet with little meat or fish, so keep that in mind. The omnivores still consumed very little meat, but they still had a higher risk of diabetes. In the largest prospective study of plant-based eating patterns to date, evaluated dietary choices and type 2 diabetes incidence in Nurses Health Study. Nurses Health Study 2 and Health Professionals Follow-Up Study, eating patterns were stratified by an overall plant-based diet index, in which plant foods received positive scores while animal foods, including animal fats, dairy, eggs, fish, seafood, poultry, and red meat, received reverse scores. In the healthful version of this plant-based index, fruit juices, refined grains, and added sugars also received reversed scores. So keep that in mind. These are things you don't want to include in your diet: fruit juices, refined grains, and added sugars. So no white flours, no fruit juices, and no added sugars. Analysis of the data from 4.1 million person years. So that's 4.1 million years worth of people. A follow-up revealed that those most adherent to the healthful plant-based dietary index had a 34% lower risk of developing diabetes compared with those least adherent. These associations were independent of body mass index and other diabetes risk factors. Food and nutrient components of plant-based foods. Whole food plant-based eating patterns generally include legumes, whole grains, fruits, vegetables, nuts, and they're high in fiber. All of these elements have been found to be protective against diabetes. So legumes, whole grains, fruits, vegetables, and nuts are all elements which have been found to be protective against diabetes. Whole grains, including whole grain bread, blah, blah, blah. Specific fruits and vegetables, including root vegetables, green leafy vegetables, blueberries, grapes, and apples, have been linked to lower diabetes rates. They should exclude white potatoes, but I don't think they did. Legumes have also been shown to ameliorate insulin resistance. Okay, so consuming legumes have been shown to reduce insulin resistance. Okay, so this protects against metabolic syndrome or syndrome X, and greater nut consumption has been associated with lower diabetes risk. Cereal fiber appears to be especially protective against type 2 diabetes. Diets based on whole plant foods not only maximize protective foods, but they also exclude key animal-based foods that tend to promote insulin resistance, particularly processed and unprocessed red meat. Risk estimates from recent meta-analyses on meat consumption and type 2 diabetes range from 1.13% to 1.19%. Per 100 grams of, so 1.13 to 1.19 grams per 100 grams of total red meat per day, and from 1.19 to 1.51 per 50 gram of processed meat per day. So that's the meat consumption and type 2 diabetes range. That's so animal protein and animal fats have also been linked in both metabolic as well as large cohort studies to worsening insulin resistance. I did this before when I showed that eating plant protein gives you health benefits, whereas eating animal protein is associated with health risks. Okay, now is it the protein? Maybe. Is it the protein profile? Maybe. I don't think so. I think it actually has to do more with what's in the meat, such as bacteria, such as viruses, such as the new 5GC, different inflammatory compounds, hormones, etc., antibiotics, blah, 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 blah. Okay, that's what I personally think, but of course, that's never going to be parsed out. Okay, because there's too many variables. Diabetes incidence over 12 years in the highest and lowest quintile of animal protein consumption, as well as 5% higher incidence per 10-gram increment of animal protein intake. So it goes up by 5% per 10 gram. Similarly, during 4.1 million person years of follow-up of participants in the Nurses' Health Study, Nurses' Health Study 2, and Health Professionals Follow-Up Study, found that individuals in the highest quintile of animal protein consumption had a 13% increased risk of type 2 diabetes, okay, compared with those in the lowest quintile. Okay. So the authors also found that substituting 5% of energy intake from animal protein with vegetable protein was associated with a 23% reduced risk. So keep that in mind. By replacing animal protein with plant protein, you reduce the risk, okay, by 23%. Okay, so in Greece, plant-based diets for treatment of type 2 diabetes. As far back as the 1950s, studies have been published on treating hyperglycemia with high carbohydrate and low-fat diets, documenting the effectiveness of employing a predominantly vegetarian diet to treat diabetes. Performed the first major randomized clinical trial on diabetic patients treated purely with a plant-based diet, comparing it to a conventional diet based on the 2003 Diabetic Association diet guidelines. So this was a vegan diet compared to the ADA's diet. A total of 99 individuals, 27 years to 82 years of age, were randomized to the counseling on a low-fat vegan diet or the American Diabetes Association diet and followed for 22 weeks. The recommended vegan diet comprised approximately of 10% energy from fat, 15% from protein, and 75% from carbohydrate, and consisted of vegetables, fruits, grains, and legumes. Participants in the vegan group were asked to avoid animal products and added fats and to favor low glycemic index foods such as beans and greens. Okay, by the end of the trial, 43% of the vegan group and 26% of the ADA group participants reduced their diabetes medication. So you can see the great advantage here. 43% of the vegan group and only 26% of the ADA group reduced their diabetes medication. Excluding those who changed medications, hemoglobin A1C fell 1.23 points in the vegan group compared to 0.38 points in the ADA group. Body weight decreased by 6.5 kilograms in the vegan group and 3.1 kilograms in the ADA group. Among those who did not change lipid-lowering medications, LDL cholesterol, so this is, keep in mind, they're factoring this in. This is important because they're factoring this in. So those that did not change lipid-lowering medications, their LDL fell by 21.2% in the vegan group and only 10.7% in the American Diabetes Association group. After adjustment for baseline values, even the reduction of urinary albumin was significantly greater in the vegan group, which means they're pouring less protein in their urine. Okay, they're losing less protein in the vegan group. When these individuals were followed for a total of 74 weeks and a sustained and equivalent weight loss was noted in both groups, but there was a significant absolute reduction in hemoglobin A1C points in the vegan group. Now that probably might have to do with the high amount of folic acid in the vegan diet. In addition, there was a significant reduction in total cholesterol, reduction in LDL cholesterol in the vegan versus the ADA group, blah, blah, blah. While this may be surprising, given the potential degree of change required to adopt a vegan diet, the authors hypothesized that not limiting portion sizes, not counting calories or carbohydrates, and experiencing of a variety of new flavors in the vegan diet likely offset any hardship imposed by restricting animal products. So keep that in mind. This wasn't just a diet. This was the easiest vegan diet you could do. Okay, you're not. Okay, you're not counting calories. You're not counting carbohydrates. You're not. What do you call it? You're not. Well, you're not counting calories or carbohydrates, and you're trying to experience new flavors. So that offset any of the hardships imposed by restricting animal products or added oils. High carbohydrate, low fat, predominantly vegetarian diets are often associated with weight loss, making it difficult to ascertain what proportion of the improvement in glycemic control is due to weight loss versus dietary changes. To evaluate this question, they performed a study on metabolic ward enrolling lean men with type 2 diabetes who were taking insulin and placing them on a high carbohydrate, high fiber diet. So that would be 10%, under 10% calories from fat, 70% from carbohydrates, blah, blah, blah. Body weights were stable by simply, half of the participants were able to discontinue insulin, and the remainder were able to significantly reduce their insulin. Okay. Reduction of diabetes-related complications. The benefits of tight glycemic control with pharmacotherapy have been called into question based on a lack of evidence for it preventing major clinical endpoints, including all-cause mortality. So tight glycemic control doesn't seem to stop all-cause mortality, cardiovascular mortality, dialysis, renal death, blindness, and neuropathy. In contrast, plant-based diets have demonstrated improvements in glycemic control while also reducing macro and microvascular risks in type 2 diabetics. Cardiovascular disease and risk factors. Cardiovascular disease is the major cause of premature mortality in the diabetic population, and many trials have demonstrated the benefits of plant-based diets in preventing and treating cardiovascular disease. In the large cohort studies, vegetarian diets have been associated with 24 to 32% reductions in ischemic heart disease incidence and mortality relative to omnivorous diets. Intervention trials of plant-based diets have also documented angiographic and clinical reversal of coronary artery disease, randomized individuals with cardiovascular disease to usual care or lifestyle treatment that included a low-fat vegetarian diet in combination with moderate exercise, stress management, and smoking cessation. After 5 years, LDL levels in the lifestyle intervention group decreased by 20% from baseline without lipid-lowering medications. Levels similar to that of the usual care group, 60% of whom were on lipid-lowering medications. In the lifestyle group, the average degree of coronary artery stenosis decreased over 5 years with a 7.9% relative improvement by year 5, compared to the 27.7% worsening in the usual care group. There was a 60% reduction in cardiac events in the lifestyle group compared with the usual care group. So you have a 60% reduction in cardiac events in the lifestyle group compared with the usual care group. Okay. So Dr. Etzelstein examined the effects of making dietary changes alone without other lifestyle interventions on patients with established cardiovascular disease. 11 patients with severe coronary artery disease, blah, blah. They were put on a low-fat, plant-based diet. They had documented regression of coronary artery disease on repeat angiogram after 5 years on the diet. In a subsequent review, outcomes were reported on 198 consecutive patients with cardiovascular disease who voluntarily came to the Etzelstein program. A total of 89% were adherent to the diet, consuming a whole foods plant-based diet without any meat, including poultry and fish, dairy, eggs, or added oils. The cardiovascular event rate was extraordinarily low among the adherent patients versus 62% among the non-adherent patients. A large body of evidence also supports the use of plant-based diets for the reduction of cardiovascular risk factors it is well known that the prevalence and incidence of hypertension are significantly lower in those following plant-based diets compared with omnivores. In the Advanced Health Study 2 cohort, vegans had approximately half the odds of having hypertension as omnivores, and after adjustment for body mass index, animal protein has been shown in several prospective studies to increase the risk of hypertension. So keep that in mind. Animal protein has been shown in several prospective studies to increase the risk of hypertension, while plant protein tends to lower blood pressure. So keep that in mind. Plant protein tends to lower blood pressure. Animal protein tends to raise blood pressure. Literature review of plasma lipids in plant-based diets found that among different plant-based diets, lacto-ovo-vegetarian, and vegan populations following vegan diets had the lowest cholesterol concentrations. This review also had found that plant-based diets are associated with up to 35% reduction in serum LDL cholesterol, whereas interventions allowing small amounts of lean meat demonstrated less dramatic reductions in total cholesterol and LDL levels. Okay, chronic inflammation is measured by C-reactive protein, has been linked to risk of cardiovascular diseases, blah, blah, blah. Okay, Western meat-centered diet, so diets tend to have, people that follow a meat-centered Western-style diet have higher biomarkers of inflammation, whereas those following vegetable and fruit-based patterns tend to have lower levels of biomarkers among intervention trials of plant-based diets. A recent systemic review and meta-analysis found that those adopting a fully or mostly plant-based diet had significant reductions in C-reactive protein. Renal disease, chronic kidney disease rates increase with age, and among those older than 60, renal impairment is more common in diabetic versus non-diabetic patients. It found that in individuals with chronic kidney disease defined as blah, 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 so it was 23, so an increase, found that individuals with chronic kidney disease increase in plant to total protein consumption, meaning if you were significantly lower. So if you're eating more plant protein, you're having a reduced risk of mortality. And a crossover trial testing whether albuminuria can be improved in diabetic patients with advanced kidney disease simply by replacing the source of protein. So this is important to understand. So red meat in the usual diet was replaced by either chicken as the major source of protein or low protein lacto-ovo-vegetarian diet. At the end of 4 weeks, albuminuria on the vegetarian and chicken diets less than after 4 weeks, strongly suggesting that the protein sources impacts the degree of albuminuria. A recent review outlined how a Western-style diet characterized by high intake of red meat, animal fat, highly processed food, and low intake of fruits and vegetables is associated with kidney disease. A variety of mechanisms were proposed for this association, including increased animal protein leading to decreased renal blood flow and diabetic neuropathy. Diabetic neuropathy is a microvascular complication of diabetes that can be debilitating. The current guidelines and macronutrients. The guidelines recommend carbohydrate intake from legumes, whole grains. So keep this in mind. Carbohydrate intake should come from legumes, whole grains, fruits, vegetables, dairy products with an emphasis on nutrient-dense, high-fiber, low glycemic load foods is what's recommended. They also include a recommendation that people with diabetes follow the guidelines for the general population for intakes of saturated fat, dietary cholesterol, and trans fat. Plant-based diets are consistent with these guidelines. The Academy of Nutrition and Dietetics states that vegetarian and vegan diets are appropriate for all ages. Keep that in mind. Let me be clear here. Besides infancy. Okay, so what I mean here is it says from infancy to adult, but that should be clarified. That should state on a weaned infant. okay? It gets me really pissed when I see vegan parents trying to give their kid like almond milk. No. Vegan children are quite a lot like other great apes in the sense that they live on breast milk, okay? Vegan children need breast milk. That's what they need, okay? So, however, what you need to understand, the vegan diet may provide benefits for the prevention and treatment of diabetes, obesity, and ischemic heart disease. There has been a wealth of research on macronutrient ratios and current ADA guidelines state that the optimal mix of macronutrients in type 2 diabetics has not been established. In general, sources of foods are equally important, as if not more important. So let's keep that in mind. Sources of foods, animal or plant, and refined versus unrefined. So unrefined plant food is what you want to be looking for, are equally as important, if not more important. So remember, I talked about this before. The quality of diet, a high quality diet, slows epigenetic biomarkers of aging. If you read Dr. Morgan Levine's book, different people have different organ systems that age at different rates. Diabetes is essentially the aging of the pancreas, the aging of the kidneys, the aging of certain systems of the body at a quicker rate than other systems of the body. So what you have to understand is this whole food plant-based diet, this high quality plant-based diet, just as it slows the overall biomarkers of aging, it slows the rate of diabetes. Protein. Okay. Dietary guidelines emphasize lean sources of protein. The evidence does not support turning to animal sources for protein, particularly for individuals with diabetes. Plant sources of protein have the benefit of being truly low-fat in many cases, such as legumes. In addition, they supply fiber and many beneficial phytonutrients, all of which are lacking in animal foods and are deficient in the American diet. So these things, okay, these phytonutrients and dietary fiber, these are lacking in the American diet, okay, but they're in abundance in these plant foods. In terms of treating type 2 diabetes, a recent systematic review and meta-analysis of 13 randomized controlled trials evaluated the effect of replacing animal protein with plant protein on glycemic control among participants. Age was 62 years, average age, okay? There was a significant decrease in hemoglobin A1C, fasting glucose and fasting insulin, and diets that replaced animal protein with plant sources of protein at a median level of about 35% of total protein per day. So that's a relatively high protein diet. 35% of your calories is coming from protein. Another study carried out among 6,107 diabetic patients from 15 European cohorts demonstrated that replacing 10 grams of dietary carbohydrate with total and animal protein was associated with a mean 5-year weight gain, whereas replacement with plant protein was not significantly associated with weight change. So if you're replacing carbohydrate with animal protein, you may gain weight. If you're replacing it with plant protein, you may not gain weight. Moreover, substitution with plant protein conferred a significant 21% decrease in all-cause mortality. So again, eating more plant protein shows a decrease in all-cause mortality. Okay? So, and another cohort study of 131,342 adults found that in participants with at least one unhealthy lifestyle factor, substitution of 3% of energy from plant protein in lieu of animal protein was associated with a 10% decrease in all-cause mortality and a 12% decrease in cardiovascular mortality. Fats. In relation to insulin resistance, the weight of metabolic studies and epidemiological evidence suggest that the type of fat in the diet, e.g. saturated, polyunsaturated, or monounsaturated, is highly relevant. Saturated and trans fats increase the risk of developing diabetes. Moreover, in diabetic patients, saturated fats are actually associated with increased mortality when they replace carbohydrates in the diet. Okay, a recent systematic review, blah, blah, blah. Okay, feeding trials of saturated fat and polyunsaturated fats, replacing carbohydrates, mainly refined starches and simple sugars, and saturated fats with monounsaturated and polyunsaturated fats lowered hemoglobin A1C. So replacing bad carbohydrates and saturated fats, meaning animal fats most likely, with monounsaturated and polyunsaturated fats lowered hemoglobin A1C and improved insulin resistance, meaning it made the people more sensitive to insulin. Polyunsaturated fats were also noted to improve insulin secretion. The authors concluded that in comparison to carbohydrates and saturated fats, monounsaturated and polyunsaturated fats had the most favorable effect on glycemia, insulin resistance, and secretion in terms of foods. These findings support consumption of vegetable fats, meaning nuts, avocados, and olives, in place of animal fats and refined grains. So you should be trying to replace, and I'll get into this with the Eco-Atkins diet, so it supports consumption of vegetable fats in place of animal fats. Furthermore, there may be a threshold beyond which the total fat also affects insulin resistance. An observational study of 1,785 European adults aged 50 to 75 years old with type 2 diabetes, increasing total fat intake from under 25% to over 35% was associated with a significant increase in LDL cholesterol, triglycerides, hemoglobin A1C, and C-reactive protein, whereas increasing carbohydrate intake from under 45 to over 60% was associated with significantly lower triglycerides. Now, you might have to look at the sources of the carbohydrates. Carbohydrates, and the perception of carbohydrate-rich food should be avoided in people who have or are at risk of type 2 diabetes. Okay, it is essential to distinguish between the types and sources of carbohydrates. Meta-analysis and cohort studies demonstrated that carbohydrates from whole grains and cereal fibers reduce the risk of developing type 2 diabetes, while refined low-fiber carbohydrates can increase the risk of diabetes. Metabolic studies also confirm benefits of carbohydrates in comparison to animal proteins, compared high protein versus high carbohydrate diets while keeping fat intake constant at 30%. For a period of 8 weeks in patients with type 2 diabetes, the carbohydrate group was instructed to eat more bread, cereal, pasta, and starchy vegetables, while the high-protein group was instructed to have more fish, chicken, and eggs, low-fat milk, cheese, and nuts. Although weight loss was equivalent in both groups, the high carbohydrate group had a decrease in hemoglobin A1C and fasting plasma glucose. Moreover, low-carbohydrate diets have been found in several studies to actually increase the risk of type 2 diabetes among more than 40,000 men in the health professionals follow-up study. The highest quintile of low-carbohydrate eating pattern when based on animal sources so keep that in mind because we're going to talk about this when we get into the Eco-Atkins diet. When based on animal sources, conferred a 37% increased risk of diabetes. Interestingly, when the low-carbohydrate diet was based on vegetable sources, it was protective. So keep that in mind. When low-carbohydrate diets are based on vegetable sources, not animal sources, they are protective. So the Eco-Atkins diet is protective. Okay, so has a similar protective effect of plant-based low-carbohydrate diets among women in the nurses' health study. Although in this population, the overall low-carbohydrate score did not increase. In the nurses' health study, gestational diabetes, there was a 36% increased risk of diabetes among women with the highest overall low-carbohydrate diet and a 40% increased risk when the low-carbohydrate diet favored animal products. So you're looking at a 40% increased risk when you're favoring animal products. Okay, keep that in mind. Mechanisms of plant-based diet in treating insulin resistance. Okay, Plant-based diets are high in fiber, antioxidants, and magnesium, all of which have been shown to promote insulin sensitivity. Antioxidants such as polyphenols may inhibit glucose absorption, stimulate insulin secretion, reduce hepatic glucose output, and enhance glucose uptake. Fiber, which is found only in plant foods, modulates prandial glucose response and is fermented by the intestinal bacteria to produce short-chain fatty acids, which also improve glucose response, insulin signaling, and insulin sensitivity. Furthermore, fiber reduces the energy density of foods, promotes satiety, and has been associated with, weight loss. So fiber reduces energy density of foods because it's not a food that you can burn as energy. Okay, remember that. That's why when you're counting carbohydrates, you have to remove the dietary fiber, because dietary fiber is a carbohydrate, but it's not digested as such. Dietary fiber has been linked to decreased markers of inflammation, which may also ameliorate insulin resistance. Finally, a diet high in plant-based foods and low in meat is likely to exert beneficial metabolic effects by promoting shifts in gut microbial profile, decreasing the production of trimethylene nitrous oxide, a compound that has been tied to insulin resistance. Plant-based diets also tend to be low in saturated fat, advanced glycation end products, which causes cross-linking, nitrosamines, and heme iron, dietary elements that have been associated with insulin resistance. Okay, saturated fat has been associated with oxidative stress, mitochondrial dysfunction, and insulin resistance. In addition, diets high in saturated fat are associated with predominantly gram-negative blah, blah, blah. Okay. Advanced glycation end products are oxidant compounds that are high in meat, especially when meat is grilled, broiled, roasted, and seared. Now remember or fried. Now remember, I talked about this. This probably could be reduced by steaming or boiling meat or stewing meat. And low in plant-based foods such as fruits, vegetables, legumes, and whole grains, advanced glycation end products have been implicated in the pathogenesis of type 2 diabetes. So when you're browning meat, it raises your risk of type 2 diabetes. Nitrosamines, which are created when nitrate and nitrate preservatives in processed meat bind to amino compounds in those foods, have been shown to accelerate DNA damage and generation of reactive oxygen species. Iron from heme sources is a pro-oxidant molecule. Finally, plant-based diets tend to promote weight loss and lower body fat, factors that are highly protective against insulin resistance. Furthermore, a hypocaloric, high-protein diet is used for weight loss. The high-protein content itself may negate key metabolic benefits of weight loss, found that in obese postmenopausal women, a low-calorie, high-protein diet prevented the therapeutic effect of weight loss on skeletal muscle insulin sensitivity, likely due to worsening oxidative stress. Okay, but remember, if you're getting your protein from plant sources, it's protective. Refined grains and added sugars have been implicated in weight gain and insulin resistance. A whole foods plant-based dietary approach excludes animal products, refined grains, and added sugars, thus encouraging insulin sensitivity through loss of excess weight and maintenance of a healthier body weight. However, as noted previously, metabolic and epidemiological studies confirm that plant-based diets improve insulin resistance even when there is no weight loss. Okay, so keep that in mind. Plant-based diets improve insulin resistance even when there is no weight loss. Implementation in clinical practice. Some clinicians may assume that their patients will not be able to do. Conclusion. There is a general consensus that the elements of a whole foods, plant-based diet, legumes, okay, so this is what it is, legumes, whole grains, fruits, vegetables, nuts, with limited or no intake of refined foods and animal products, is highly beneficial for preventing type 2 diabetes. Equally important, plant-based diets address the bigger picture for patients with diabetes by simultaneously treating cardiovascular disease, the leading cause of death in the United States, and its risk factors such as obesity, hypertension, hyperlipidemia, and inflammation. The advantages of a plant-based diet also extend to reduction in risk of cancer, the second leading cause of death. Now remember, if you follow Dr. Levine's work in the book True Age, and if you follow other gerontologists' work, diseases are really the side effects of aging, and different systems age at different rates. And a plant-based diet slows, a whole food plant-based diet, a high-quality whole food plant-based diet, slows the rate of epigenetic or biologic aging. Okay, so I'm going to call that quits for this video, and I'm going to continue later.